Hey guys, this is Dr. Hub. Today we look at the multiple myeloma. And under multiple myeloma, we are going to focus on the pathological cells and the bodies. So pathological cells and the bodies it contains. So the first one in the multiple myeloma is going to be the Dutcher bodies. So there's Dutcher bodies. So what are present in the Dutcher bodies? It includes pale staining. There is pale staining and there is PAS positive intracellular inclusions. The PAS positive, and this is a intracellular inclusions, and this is within the plasma cell containing IgG, and this is within the plasma cell containing the Ig, and which are more common in IgA melanoma. It is more common in cases of the IgA myeloma. Then we move on to, there is some Russell bodies. So Russell bodies are nothing but a globular intracellular accumulations. They are globular intracellular. They are globular intracellular accumulations. And this is of nothing but the Ig, that is the immunoglobulins. And this Russell bodies, they are a distended endoplasmic reticulum. And the plasma cells are filled with the multiple Russell bodies are known as Mott cells. The plasma cells which are filled with the multiple Russell bodies. So they are nothing but the Mott cells. MOTTCELS, that is a Mott cells. Lastly, there is also presence of flame cells. So what is flame cells? Flame cells means the plasma cells with fiery red cytoplasm. So there is plasma cells and they are present with the fiery. There is fiery red cytoplasm. The fiery red cytoplasm, and this is due to a vermilion staining. This is due to vermilion. This vermilion staining. And there is also the glycogen rich IgA. This is glycogen rich IgA, and this is the cytoplasmic projections.